Hey everyone, my name's Christina. I'm a public health registrar, and welcome to the Bolder Healthier Workplace Champions Cost of Living webinar. Thanks so much for attending. And as Ben said, this webinar will be recorded for those who can't attend, as there are 4 webinars in this cost of living series. In addition to this one, there's also a youth, community, and a plus webinar. So the information in today's webinar is intended for use by the Workplace Champion strand. However, a lot of the information regarding rising cost of living is transferable as well. So, what is cost of living? What is the cost of living crisis? It is a term we've heard more and more of throughout the last year, and definitely more in the last couple of months. It's a situation in the UK from the 2021 onwards. It is a term which can cause anxiety, worry, and uncertainty. It refers to the cost of everyday essentials like energy and food rising faster than average incomes. There is a growing gap now between what people have and what people actually need for a decent standard of living. Rising costs present the most significant challenge to living standards for many years, especially after the social and economic uncertainty following the COVID-19 pandemic. So we know that the rising cost of living is affecting and will continue to impact everyone. In July 2022, 91% of UK households reported that their cost of living had increased in the previous month, and that was up from 62% in November 2021. This was mainly attributed to higher food, electricity, and fuel costs. Unfortunately, this crisis will impact the poorest UK households, those already spending a significant proportion of their household income on food and housing costs. Financial forecasts predict that real household disposable income in the UK will continue to fall in the coming year by 22.2%. And this reflects the biggest fall in living standards since the mid 1950s. So what is going up? It seems like everything's going up. We presented some of the key costs that may be affecting individuals and households. However, this isn't an exhaustive list. We know that there are many other aspects of people's lives that are being affected by this. So average travel costs have increased by 45%. We know that rent and mortgage prices are going up. So that's social housing rent increasing by 4.1%. Private rental prices have also increased by 3%, and mortgage interest rates continue to rise. Water bills and energy bills have increased. We hear a lot about energy household bills, which causes anxiety and worry for a lot of households. They increased by 54% in April, with a further rise in October. Childcare annual costs have increased, so this includes things like nursery places and after school clubs, and this was 16% between 2018 and 2022. In addition, as well, personal goods and services for a single working adult per week have increased by 49%. So that's household essentials, food, drink, and things like that. We know that our communities are taking action because of these rising costs. So the information here is taken from the 2021 census for the West Midlands, and it shows that 89% of people reported their cost of living increasing over the previous months. That was March to June of this year. So 6 in 10 people reported spending less on non-essential items. 5 in 10 people reported using less gas and electricity in their homes. And we can tell that that's going to have a really large impact on people, especially going into winter now. 5 in 10 people are cutting down on non-essential journeys in their vehicle, affecting their participation in social activities or even work. 4 in 10 people are spending less on food shopping and essentials. And worryingly, 1 in 10 people are using more credit than usual, exposing themselves to debt that they might not have necessarily had before. So this slide aims to present some of the impacts of the rising costs of living to our communities, although again, it's not an exhaustive list, and there will be effects that you see in your communities and your workplaces that are not listed here. So fuel poverty, cold and damp living conditions increase the risk of medical conditions such as respiratory and cardiovascular illness, and can also worsen existing long-term conditions. This can lead to turning down the heating, cold-related deaths, and poor health. So the rising cost also has a social and mental health impact on individuals and communities. So shame over requiring financial or food assistance, as well as Financial pressures can increase the stress and anxiety caused by rising costs. When rising costs impact social activities, this can also lead to loneliness and social isolation as people choose to not pay for travel and activities. Um, Debt is a really worrying consequence of rising costs in our communities and has the greatest impact for those people already on low or unstable incomes or relying on benefits. Not meeting rent or mortgage repayment obligations will create financial pressures, which will affect decisions that can be as severe as choosing eating over heating. Housing, as we've mentioned, costs are rising, and this could lead to forced evictions and debt. There is a risk that more people will sleep rough for the first time as households struggle to make ends meet. Air quality is something that may impact some people in Birmingham, so more people may rely on wood or solid fuel burners due to the cost of electricity and gas, and this in turn will affect air quality and impact on respiratory and cardiovascular conditions. High price rises in food and energy mean people may be thinking twice about what they're buying. So, again, leading to really tough decisions, sometimes meaning that people may be skipping meals or may have less money available to spend on healthy food, all leading to malnutrition and general impact on health. So, as has been mentioned, it is a really shifting landscape, and the impacts of the rising cost of living will be seen for months and even years to come. The national and local response is, as a result, also changing, and the council's response is going to change as time goes on. We really recommend staying abreast with the local response by regularly checking the council's websites for updates um, over the coming months. Thank you. So, the key messages and call to action for bolder, healthier workplace champions just follows these three steps. So, number one, talking about the impact of rising costs of living helps reduce shame and stigma and also helps to raise awareness. Secondly, connecting and signposting people to support and services. And finally, feedbacking to us so that we can continue to improve the support for citizens. So we're going to go through those three steps in detail. So the first one, talking about the impact that the rising cost of living is having on people in your community, in your workplace, um, and we're looking at this now from the viewpoint of talking to employees and also talking to small and medium-sized businesses. What we would say is that Bolder Healthier Champions shouldn't act as financial advocates for people in financial insecurity and should not receive personal financial information from people. So, breaking it down into talking to employees. So, that's people that you may know in your workplace or outside of it. You may find yourself having conversations in your community with friends, neighbours, colleagues, family. And again, this reduces shame and stigma and also allows people who may not have had experienced financial insecurity or debt prior to this crisis, who might be finding it even more difficult to open up and talk about the impact that rising costs have on them now. So some of the examples of conversations or scenarios which you might find are here. So when you're talking to employees, it might be that remote working might be increasing their household and bill costs. They might be experiencing the increase in travel costs quite heavily if they live far from their work, which means getting to work is harder. And as a result of businesses struggling to make decisions around staff cuts and redundancies, this might be having an impact directly on somebody that you know who may have lost their job. Those on 0 hour contracts similarly will face even greater employment insecurity during this time. And as a result of real household disposable income falling, wages may not be keeping up with the cost of living. So people might be using their savings and credit to get through this time. Rising childcare costs may impact a household's decision around somebody in the household leaving employment, again, exposing them to more financial insecurity in the long term. And it can't be left out at all that financial troubles cause chronic stress and anxiety, self limiting socialization, and potentially overworking as well. Working adults may be required to take on several jobs to make ends meet. And also thinking about unpaid carers who may find themselves in debt as a result of their caring role and their financial situation. So we've also taken the angle of speaking to small and medium-sized businesses in Birmingham who will be facing unique challenges while navigating the cost of living um, on their profit margins, but also being fair to employees as well. So when businesses move to a remote working model, this increases the costs for their employees. During this time, if they need to get accounting advice to think about their assets and look and make some forward planning, this might not be affordable at all. Materials and packaging costs increase, which impact on profit margin. Businesses may be in need for more staff but unable to hire, so this impacts on their growth again in the long term. Energy and office spaces will be more costly, especially if the office space isn't fully utilised or when the equipment that's being used in the businesses have higher energy consumption. And then again, following on from the accounting advice, other organisational tools and software are expensive, so businesses may not be able to afford these. So what we want to suggest is following the ask, assist, and act model. So this is a way that you can provide brief support in your everyday interactions. It's grounded in MEC theory, so making every contact count, and it's something that you can utilize in every conversation. So we've got a couple of examples here for conversations that you might be having with colleagues and friends and family. So for budgeting, it's really important to ask open questions such as, do you have any worries relating to money, budgeting, borrowing, or debt? This opens up the conversation and gets it moving in the right direction. You could then offer some assistance and provide some information around why it would be helpful to learn more about budgeting or the risks of borrowing and debt, and ask them if they want that information, if they're willing to accept help and signposting. And then finally, the act step is to, once that conversation's been opened, the door's opened, you can signpost somebody to expert advice and assistance. Again, it's not about being a financial advocate, and it really is a brief conversation. So that final step is signposting somebody to the tools that they need for effective support. So here we have the Money Helper service, which is free and impartial advice from the government. Another example, such as debt and borrowing, again, asking open questions. If you need to borrow money, have they considered the risks of doing so? Assisting by asking, if they want that support, if they would like some additional information about recommended debt advice services, and then acting. So there's a number of debt agencies that you can provide them with. And we'll go through a list of resources for all of those costs that we've spoken about in the next slides. But this is about the next step of advice of providing them information around a debt agency such as National Deadline or Step Change. And the final example is one around non-urgent mental health support. So first and foremost, if someone is at immediate risk of harming themselves or others, or they're having an urgent mental health crisis, then they should be advised to go to their GP. But for those situations where you're able to ask open questions, it really is about asking how they are, how they're feeling, and what's been happening recently in the context of rising costs that might be making them feel that way. Once they're open to assistance and you've said that you can provide information on services, then in a similar way as the previous slides, you can act by encouraging them to access the resources around mental health and wellbeing. Some are listed there, such as Mind, the NHS resources, and also Birmingham City Council wellbeing resources. So returning to our call to action, the next step is connect. The hope is that the following pages can be used as a resource and for yourselves. So when you do speak to people, you're aware of what's out there for all the different conversations that you might be having and scenarios that you face. So connecting employees or other people indeed to crisis support. So this is meant for the short-term crisis that somebody might be facing. We would recommend signposting them to Birmingham City Council's local welfare provision scheme. This helps vulnerable people in a short-term crisis. There are additional links there to services which may be helpful depending on the situation. So Birmingham and Solihull's Women's Aid, um, or food banks as well, or additional financial assistance. Council support is always a good option for somebody who requires support on a range of topics at once. So, support with emergency food, benefit inquiries, council tax, or housing issues such as homelessness. They can be contacted on that number there, and there are also 2 walk in advice centres available. So, support with bills is always one that might be handy. So first of all, thinking about information on UK government schemes, making sure that they're aware of all the entitlements that they might be able to get, such as the cold weather payment, winter fuel payment, or the pensioner cost of living payment. There are some local schemes in Birmingham to help with energy bills, and that's best found on the Birmingham City website. And then thinking about other bills, so phone bills, water bills, those links there are a useful starting point for people who are looking to reduce their costs. So connecting people to income and debt support is really important. So again, think about UK government information. They can check to see if they're getting the minimum wage. They can access their services such as the Money Helper service or Help to Save for the short and long-term support. And then there's debt advice services that are listed there that can provide the expert, impartial advice that somebody needs. So again, opening the conversation around debt and then signposting them to a service rather than trying to fix that problem or find out more information on the spot. So, connecting employees with support with works, these might be specific to the type of work somebody might be doing. And again, will be you can pick out depending on what kind of conversation you're having. But advising somebody if they're a member of a trade union to get support that way. Local citizens advice online is really good for getting help with employment problems or employment tribunal claims. Professional bodies, if somebody is registered with one, is always a first port of call, good first port of call. Similarly, support for disabled people getting into work, Scope is a good service for them to get in touch with. And support for unpaid carers, Mobilise, um, can help identify condition specific charities and organisations that can help that person. This is kind of a miscellaneous page, but firstly, the Birmingham City Council's cost of living support page has information on income support, debt, and money advice. So if you're short of time, that is a good starting point to send somebody to. Mental health and wellbeing support, as mentioned on the other page, the Birmingham City Council Wellbeing Resources page is a really good landing page to start from. Making sure somebody is aware of any travel discounts that they might be entitled to. And then if a family has young children or maybe pregnant, they may be entitled to Healthy Start vouchers for help to buy healthy food and milk as well. And then thinking again about small, medium-sized businesses, how would you connect them with resources and support? So again, Birmingham City Council have some support available. And then national resources for businesses such as the Living Wage Foundation, Reuse Network, and Business in the Community have a range of toolkits that help that been put together for help during this time, helping businesses think about how they're going to navigate the cost of living crisis. And then also signposting them to UK government resources for businesses around energy bill relief, improving the energy performance of the business, and then also getting tax relief on work related expenses. So it's about understanding what all the resources are out there, making sure businesses can claim or find out about what they're entitled to. So, ending with a case study example. Again, this is not a prescriptive example, and you'll have individual circumstances that you find yourself in, but this could be food for thought. So, John is a Bolder Healthier champion working a local estate agents in the city centre. He's close friends with the owner, David, and over lunch one day, David explains to him that he is anxious about the rising cost of living and the impact this has on him as a small business owner. So, so this person has opened up about how it's harder to cover energy bills in a small office space, and they're worried about the next year and the sustainability of their small business. So first of all, the Bolder Healthier Champion is able to ask them open questions and then assist and act by providing government resources for supporting businesses with energy costs, and then can also signpost them to the national resources around helping businesses stay energy efficient. So by asking them if they want to have access to this information, it allows somebody to feel empowered to take those next steps. So moving on from that in the conversation, after talking about the worries around the business, this business owner talks about how it's really getting them down and they don't want to worry their family. So it's kind of moving on to the individual aspect of the conversation. So the Bold Healthy Champion expresses empathy and is really sorry to hear that they're feeling overwhelmed, and asks them whether they would want some more information about mental well-being support and services in case they need it. So has targeted two issues there in the conversation, has signposted them to resources in both instances. So coming down to the last step in that call to action is feedback to us. So wherever more help is needed and we can continue to improve the support for citizens, that email address there is open for any sort of queries or feedback, and we welcome any insights that you have while speaking to members of your community. So to round this up, I just wanted to go through that call to action again, just to reiterate those steps. So number one is talk about the impact, find out about what's going on in people's lives and how the rising cost is impacting them individually. And then secondly, connecting people to support through the range of web pages and services that are in this presentation, or indeed other ones that you're aware of. And then finally, feedback to us. And this helps us in that cycle of improvement, especially as the cost of living crisis continues to impact Birmingham's residents over the next months and even years. And that's the end of the presentation. Thanks so much for listening.